Welcome. This video was developed to show you some valuable patient consultation skills. We'll follow a model laser vision correction team as they walk through the steps of the consultation process with two prospective patients. Along the way, we'll be highlighting some important things to keep in mind as you do your own consultations. Before the arrival of any potential patients, take a look around your office. Remember that first impressions count, so make sure prospective patients have a good impression of your practice environment. The patient's arrival at your office sets the tone for the entire consultation.
Good morning.
Hello.
How may I help you?
Yes, I'm Debbie McKee. I'm here for a consultation.
So nice to meet you. Please help yourself to our refreshments. The restroom is through this door and on the left. After you get settled, could I ask you to fill out these forms?
Sure, I'd be happy to.
How can I help you?
I'm Brian Pearson. I'm here for a consultation. I'm not really sure whether this is the best solution for me since I've got an astigmatism.
Well, options for correcting your astigmatism can be determined and covered in more detail during your consultation. In a few minutes, I'll be introducing you to Andrea, our laser vision coordinator, Leslie, our technician, and then you'll see Dr. Phillips for an eye examination.
While everyone is unique in their individual life experiences, there are common ways that people express their personality. Prospective patients can be said to have 4 distinct personality traits. Friendly personalities respond to personal stories and encouragement, while expressive people want to share their own experiences. Analytical personalities are more interested in facts and details, while controlling personalities need to be the driver during the consultation. Individualize your approach to work with each personality type in a way that will make them comfortable. Let's look at how our laser vision correction team works with Brian and Debbie. Brian has analytical and controlling traits, while Debbie is a more friendly, expressive type. The consultation is your practice's opportunity to learn about the patient and address their questions and concerns. Everyone who performs the initial interview should be comfortable with the 3-question opening. Let's see how much information our laser vision coordinator, Andrea, is able to gather with 3 simple questions.
So Debbie, can you tell me why you're interested in laser vision correction?
Well, I've never really been happy with the way I look in glasses, and I can only tolerate my contact lenses for a few hours a day.
The answer to this question will let you assess the patient's level of interest. It also tells you their particular motivations and issues and gives you a chance to uncover objections. Let's see how Andrea handles the analytical and controlling Brian.
How long have you been considering laser vision correction, Brian?
I've been doing research for about 6 months, researching on the internet, reading about it, and checking it out.
Excellent. It's really great when patients learn as much as they can about laser vision correction. What are your conclusions about what you've read?
I'm just not sure I'm going to get the results I'm looking for. I wouldn't want to make my vision worse.
I can certainly appreciate your concerns. Of course, no one can guarantee that you'll have perfect vision after this procedure. Just as with any surgery, there is a potential for complications. However, Dr. Phillips has performed this laser vision correction procedure more than 1,200 times, and he can tell you about the results his patients have experienced.
Does he have testimony?
The 3rd question is critical in helping you to determine any possible objections.
So why haven't you had laser vision correction done yet, Debbie?
I'm just not sure I can afford it. What does it cost to have this procedure?
We have a lot of...
A clear and frank discussion of pricing will help patients feel more comfortable and assist them in making a decision.
Because here is a summary of the services that we include in our price.
Okay.
And you'll see the breakdown of all the...
If you are confident and comfortable with your pricing, the patient is likely to be more comfortable too. Never apologize about price.
But your prices are higher than a couple of other practices in the area.
When you're looking at cost, you'll want to compare the total treatment plan. Our price includes not only the consultation.
Take pride in sharing your practice's unique strengths, the physician's experience, special services, and so on. And again, you can help prospective patients with their budgeting concerns by candidly exploring all the payment options you offer for laser vision correction at your practice. The primary purpose of diagnostic testing is to assess whether a patient is a good candidate for laser vision correction. Keep in mind, that as you are performing tests, your patients are also assessing your potential to be their laser vision correction provider. They'll want to be assured that your practice is focused on them as a unique individual, rather than just one of many patients.
We offer Vizix Custom View, an individualized laser vision correction procedure that enables Dr. Phillips to measure and correct the imperfections that are unique to your individual vision. I'm going to use the WaveScan technology to measure the unique imperfections of your vision.
Take the opportunity to explain how WaveScan technology works.
First, the WaveScan technology produces a detailed map of your eye. Then this information is translated into custom view treatment instructions, which are transferred to the laser, enabling the doctor to tailor a correction for the unique characteristics of your vision. You'll have plenty of time to discuss the maps of your vision with Dr. Phillips in a few minutes.
Make sure that you allow a comfortable amount of time for the diagnostic portion of the consultation. Patients will feel more at ease and comfortable if you're taking all the time necessary to assess their vision and focus on their unique needs. The key role of the physician includes performing medical examinations and screenings. It is the doctor's responsibility to advise whether or not a prospective patient is a candidate for laser vision correction. The doctor will also explain the benefits and risks of laser vision correction and provide the patient with the appropriate patient information booklet.
Brian, I'd like you to meet Dr. Phillips. This is Brian Pearson.
Hello, Brian.
Hi.
Brian has some questions about his astigmatism and isn't sure whether laser vision correction is right for him.
Oh, all right. Well, Andrea, thank you. Let me take it from here. Well, Brian, first of all, Custom View is approved to treat the broadest range of individuals, even those with astigmatism. Secondly, at our practice, we've treated many astigmatic patients who've been very satisfied with their results. Why don't we take a look and see if you'd be a good candidate, and then I can answer your questions in more detail.
All prospective patients want enough information to make a suitable decision and know that they're in good hands should they decide to have the procedure. The closing interview is your opportunity to assist patients in determining whether they have decided to have the procedure. You might want to try to schedule the procedure if you think the patient is ready.
Well, Debbie, how'd it go with Dr. Phillips?
Well, he explained the maps and answered all my questions about laser vision correction. He was very helpful.
Good. Do you think you're ready to do this?
Yes, I am ready.
When would you like to schedule the procedure?
When can we do it?
Would next Wednesday afternoon or Thursday morning be good for you?
Thursday would be fine, although I'm still a little nervous.
It's normal to be nervous. However, we want you to be comfortable with your decision, so be sure and call us if you have any questions or concerns before your procedure date.
Okay.
Verbal and nonverbal cues can tell you when a patient is not ready to make a decision.
I need a little more time to think about this.
Listen for any concerns or objections. Patients' concerns should be handled with patience, understanding, and education.
Is there anything that you're specifically concerned about that we didn't cover today?
Well, my buddy had it done 5 years ago, and he wasn't happy with his night vision.
Custom View wasn't available 5 years ago. Let me get Dr. Phillips, who can answer your questions about night vision.
Okay.
So, Brian, Andrea tells me you had some questions about night vision, and I should say we get this question a lot from patients who are coming in, but tell me specifically what your concerns are.
Mainly driving at night.
Did Dr. Phillips answer your question?
Yes, he did.
Good. Do you want to schedule the procedure?
I think so. I sure am tired of these contacts.
Well, let's schedule it. And if you change your mind, you can call to discuss any questions or concerns you might have.
Okay.
You should be and sound excited, confident, and proud of your practice's ability to provide this potentially life-changing procedure. The consultation process is not finished when the patient walks out the door. Plan to follow up with the patient prior to their scheduled procedure to see if they have any questions. Also, it's just as important to follow up with those patients who have not scheduled an appointment to see if they've come to a decision or have any other questions. In order to trust their eyes to the care of your practice, patients need to feel that you care about them. Taking the time to listen, inviting patients to tell you more, thoroughly answering questions, and supporting the prospective patient's decision-making process will help demonstrate that the patient is truly important to you. The bottom line is that the consultation is your best opportunity to provide the patient with enough knowledge to make a decision. Focus on educating and supporting the prospective patient. And remember, have fun during the consultation process. This is an opportunity to build a relationship that results in successful laser vision correction and a happy custom view patient.